This is MD Rahman.
And I am Carla Huggins, and we welcome you to our presentation. Our problem of practice is non-inclusive hiring practices in healthcare resulting in diversity in the healthcare workforce. In 2023, the APTA, or American Physical Therapy Association, published a report that showed that racial and ethnic diversity of the U.S. physical therapy workforce does not match the patient population that PT professionals serve. In particular, Black and Hispanic Latino PT professionals are underrepresented. Similarly, other healthcare professions are impacted by the same challenges of lack of diversity, which brings us to our discussion today.
We would like to share our journey of discovery with this topic. Thus, our problem of practice, the purpose of our research, provide a literature review of the research on our topic, discussion, the pedagogical application and applications, and finally, provide you with our conclusions based on issues that we have identified.
Our problem. Patients, particularly those that are from underrepresented marginalized groups or URM, feel more comfortable receiving care when their healthcare provider is representative of their own culture and can relate to their own perceived experiences. With a growing overall U.S. population of URM patients, especially those impacted by social determinants of health, and a shortage of URM healthcare providers and healthcare professions, healthcare providers with similar backgrounds are needed. Similarly, URM healthcare professional faculty representation is limited in higher education because of barriers with inclusive hiring practices. Consequently, the recruitment of URM and first generation students to healthcare professional programs is directly impacted, and there is a lack of diversity in the healthcare workforce. Diversifying the healthcare workforce remains a critical goal for healthcare organizations focused on reducing disparities in care. However, it remains what remains unknown are factors creating inclusive health system environments and help organizations retain a diverse workforce. As educators, we need to play an integral role in the pipeline or pathway. Therefore, we need to seek ways to diversify the healthcare workforce. Which brings us to our purpose of our research. Our research question is, what are the factors impacting inclusive hiring practices? To address the issue of lack of diversity in healthcare, the purpose of our research was to examine the reasons for this existing problem, identifying the major contributing factors to the lack of diversity, and offer solutions to possibly minimize the problem. As we prepared for our literature review, the following keywords were utilized: healthcare workforce, diversity, hiring practices, inclusion, and minorities or URM. MD will now discuss our literature review.
Here is a map of our literature review. From our literature review, 4 themes emerged: background considerations, the benefits of inclusive hiring practices, barriers to inclusive hiring practices, and finally, solutions to inclusive hiring practices in healthcare. Theme 1, background considerations. Research has shown that as the demographic of the US rapidly changes with more URM groups, the future of the healthcare will become more dependent upon a diverse healthcare workforce. Some authors identified that structural racism has led to the exclusion of URM from the healthcare workforce, while other scholars found that developing increased understanding of healthcare inequalities is a significant factor in addressing poor health outcomes. Theme 2, benefits. Researchers have shown strong evidence that a discriminatory work hinder an organization's ability to equip the workforce it needs, leading to decreased productivity and performance, but proactively valuing diversity and inclusion can attract the best talent and create an environment of belongingness and respect while significantly improving success and efficiency of healthcare operations from a diverse lens. Specifically, some authors found that greater diversity in the healthcare workforce is seen as an effective factor to address racial and ethnic healthcare disparities by improving access, the patient experience, and increasing patient satisfaction. Theme 3, Barriers. Although research has shown that healthcare organizations seek to diversify their workforce, barriers to improve inclusive hiring include clear inclusive hiring policies or guidelines, the perceptions of a limited pipeline, and many administrative leaders continue to rely heavily on internal hires or trusted networks that may limit both demographic and diversity of thought. Whereas some researchers found that the factor of unconscious bias affects the lived experience of trainees and can potentially influence decisions to pursue certain specialties, and consequently, this may lead to the workforce. Theme 4, Solutions. Researchers agree that solutions to creating more inclusive hiring practices need to include a transparent and strategic process that is multi-pronged and systematic, and the process should adopt an organizational approach that includes multiple stakeholders, facilitating increased commitment and shared ownership. Specifically, the leadership and faculty of health professional schools need to implement policies, practices, and instructional strategies that support and leverage diversity, resulting in the emergence of innovative problem solving to better serve underserved communities, reduce health disparities, and prepare culturally responsive practitioners. Research and data-driven change. As our research support the need to educate more about diversity, to continue to this issue. Ackerman and Berger et al. Found that education and administrators in healthcare professions could use the research data promote education about microaggressions in healthcare schools to increase awareness for those going into the healthcare workforce. Additionally, these scholars showed the need for leadership and faculty of health professional schools to implement policies, practices, and instructional strategies that support and leverage diversity.
As we put all that we have learned from our research, some implications for practice may include pipeline or pathway programs to attract diverse students that begin during middle school and continue during college fairs and STEM-related enrichment programs. Academic healthcare programs should recruit and hire diverse faculty with intentionality, resulting in recruitment of diverse students. Academic healthcare leaders should implement systems and processes that provide faculty with the essential tools and information to attract quality and diversified applicant pools. Both healthcare systems and academic institutions should provide clear guidelines for the hiring processes to include the development of department statements or policies regarding recruitment and hiring of diverse healthcare professionals and faculty. And we should consider an institutional or workplace cultural transformation, holding leaders accountable for the vision. Even small changes or steps toward diversifying the climate can shift the culture in a positive direction. In conclusion, from our research, we discovered several factors that impact inclusive hiring practices in healthcare. A significant number of changes need to be made to address the problem of underrepresentation of diversity in health professions. First, structural and systemic racism is a factor. Historic structural racism has led to the exclusion of the hiring of URM in the healthcare workforce. Secondly, leadership is a factor. Strong leadership that is committed to making changes and willing to do so in the face of resistance is needed. This would include healthcare force work leaders, as well as internal and external academic leaders, such as university presidents, deans, accrediting bodies, search committees, funding agencies, and so on. All need to be willing to expand diversity. Third, admissions process is a factor. If the admissions committee is not diverse or doesn't have diverse perspectives, that will impact the recruitment of diverse students, along with whether elements of holistic admission process practices are even used. Fourth, faculty engagement is a factor. If faculty of color are not well represented on committees and are not serving as leaders, the level of meeting the needs of URM students may be impacted. Lastly, appreciating the value of diversity in healthcare is a factor. If healthcare institutions value the impact of diversity, then the positive outcomes will be reflected through patient care and outcomes, as well as patient advocacy for access. The bottom line is that when considering the changing demographics of the U.S., along with the increasing number of health disparities associated with the minority population, addressing the factors impacting non-inclusive hiring practices is crucial to changing the landscape of the healthcare workforce to reflect the patient population that we serve. The alternative, or ignoring these factors, would be detrimental to patient outcomes, healthcare access for all, healthcare effectiveness and efficiency, and patient satisfaction. Please let us know if you have any questions about our references, and please feel free to reach out to us for questions for future collaboration. Thank you very much.
Thank you.